today is a day we're focused on health and well-being. And so we have first up, Murgency.
Yeah, it's Shaffi Mather. He's over here, Extraordinary Solution. And just before he gets going, it's so important, the work that you're doing. There's a statistic that 450 to 550 people are dying per day in car accidents in India. And with just a little bit of help to respond more quickly, those lives 30% of those lives could be saved. That's a World Health Organization statistic. So people like this from around the world who are helping others in extraordinary ways with simple solutions. Thank you.
And it's amazing because so many people who have had access to emergency care are in a very different position from 90% of the world. So welcome to the stage.
Good afternoon. I'm Shaffi Mather, founder of Murgency. 12 years back, my mom had a medical emergency back in India, and my dad and I had to rush her to the hospital in the back of the car, unlike what you would do here of calling a 911. By God's grace, she survived, but for the 3 days we were in the hospital in the ICU, I started asking myself, why are there no emergency ambulance services in India? That got me passionately involved in that space, and I stepped out from everything that I was doing and founded an ambulance company with 2 ambulances with 4 of my friends. And over the last 10 years, we have grown it to 3,000 plus ambulances with 10,000 plus employees, transporting on an average 12,500 plus critical patients every day, cumulatively having transported close to 7 million patients and delivered 12,000 plus babies on board because the women or the families called the ambulance late. 2 years back, I stepped back and looked at this space from outside in. And this is what you see, and this is what I saw. 90% of world population of 6.25 billion people, primarily living in South America, Africa, and Asia, do not have access to timely medical care. They do not have a number to call. If there's a number, nobody answers. If somebody answers, there's no response. With this being the situation, we looked at it, what can we do to address this? The WHO estimates show that more people die every day from lack of timely care than from AIDS, malaria, and TB combined. So the solution we proposed is we need a global 911, not literally the number 911, but one global emergency response network. And what we are proposing to do is, with one touch alert on your mobile phone, a nearby responder physically come to respond to you. How do we do this? The business model we are developing is we're using the power of cloud technology, aggregating existing medical resources in a locality, hospitals, hospital emergency rooms, ambulances, doctors, nurses, Red Cross volunteers, etc., and using GPS logistics and what you usually see in Uber, Lyft, etc., we make the nearest responder come to you. We have also made the business model financially self-sustainable through a fee-for-service and accessible equally to the rich and poor through a cross-subsidy pricing regime. This is a sample screenshot of our app, which is being piloted in India right now. And for this ambitious program, we have a 5-step strategy to reach every corner of the world. Murgency is enrolling the private sector city by city in India, and as we raise more funds, we'll go global. We have partnered with the world's largest 3 ambulance company, US #1, Europe #1, and Asia #1. We have partnered with Global Red Cross and Red Crescent. We are in discussions with WHO, and we are partnering with the world's largest visa processing company to help travelers. The partners brings in 10,000 ambulances and 50,000 medics in US, 2,000 ambulances and 12,000 medics in Europe, and 3,000 ambulances and 15,000 medics in Asia. And most importantly, Red Cross brings in 160,000 physical locations and 17 million volunteers onto this network, which means that once we complete this, we will be the largest, widest, deepest human assistance network in the world. Our goal is to provide medical emergency response at the touch of your phone, anytime, anywhere, to anyone. We are more than a social network. It's not about messaging. It's about providing actual help when you face a medical emergency. Uber raised $15 billion to reach 400 cities and 1 million drivers. Airbnb spent $3 billion to reach 57,000 cities and 2.3 million listings. In under $25 million in partnership with Red Cross and Red Crescent, we believe that in 3 years we can be in 160,000 locations and have over 4 million responders across the world responding to save lives. What we offer is, we offer the UN agencies, federal government, state governments, city governments, and rural governments 2 models. One, the traditional ambulance model with the least cost and highest efficiency, and the new aggregating model with low capex and low opex. What we ask for is support from UN agencies, and especially WHO, to cut through the red tape and build this one global emergency response network globally, and support of $25 million for rolling this out globally across the next 3 years. Thank you.
Awesome. Terrific. Thank you. All right, so one of the things we try to do is help entrepreneurs. So everyone in this audience start thinking, everybody online start thinking, what would help to accelerate Murgency? And come on stage, one of our colleagues. So the acceleration partners who came together, and you're going to represent some of the conversation from that room. We had everyone from MIT Solve, the Skoll Foundation, Leonardo DiCaprio Foundation, SDG Philanthropy Platform, the Yes Bank team in India, the Stanford Angels and Entrepreneurs, University of Denver, and Project Flight to Denver, and the Equator Prize, and lots of youth and other people we collected. And the idea, you guys sat together. We couldn't do the brainstorming here because you'd have to wait. So you guys sat together and talked about 2/3 yes and, how to help, and a little bit of critique. So quick thoughts on ideas we would use here.
My name is Dauda Jabarte. I'm with MIT Solve. You know, one of the things that we were talking about Murgency, and it goes true for all of the other solutions that we were discussing, is really trying to create a race to the top. Right, in terms of bringing out the scale, the replication, and the resources and the partners to really, really supercharge these ideas. You know, we were talking about the cost of this not happening, right? Both financial as well as on the lives of people. And, you know, everyone was in awe of the solution that we're here talking about. And what I would love to see is, you know, finance ministers coming together and really, really trying to figure out how they can support your work and how they can use your solution in their countries to save their citizens and provide that service.
Extraordinary networking, you know, that you've developed, and how do we accelerate you? So thank you very much. All right, terrific.
Thank you.
Thank you. Thank you.